The first thing you learn in medical school, the first thing I learned in medical school, is the Latin phrase primum non nocere, which means first do no harm. Hi, I'm Dr. Mark Lowney, and I am the president of Advanced Body Sculpting of New England, as well as Studio Eros. Two different companies, same building. We're located in Fall River, Massachusetts. As far back as I can remember, I always wanted to be a physician. I kind of come from a family of physicians. My father's the oldest of 12. 7 out of his 11 siblings are physicians. So my dad's an orthodontist, my mother was a nurse. So ever since I was a young child, I've always been around physicians, dentists, and nurses. Studied hard at Boston College and graduated magna cum laude, and my Bachelor's of Science in Biology. I matriculated onto the University of Connecticut School of Medicine. Decided after doing my clinical rotations that I loved both surgery as well as obstetrics and gynecology. I ended up doing my residency at Women and Infants Hospital, which is the Brown affiliated program in Providence, Rhode Island. And I practiced obstetrics and gynecology for about 25 years. About 10 years into my practice, I had a lot of patients, obstetrical patients and gynecological patients coming up to me stating, since I've had my children, I have some issues that I was wondering if you could take care of them. Specifically, I have some areas of fat deposits that I can't get rid of. I have some extra skin in my abdomen that I'd like to get rid of. Do you know how to do liposuction or tummy tucks? And there were some academies out there that were teaching physicians how to perform cosmetic surgery. Specifically, I got involved with the American Academy of Cosmetic Surgery. First, I learned how to do liposuction, and then I went on to learn how to do abdominoplasties, followed by breast augs and breast lifts. It took me about 7 years to complete my training. After I completed the training, there's a board exam that you have to take. I passed both the written and the oral part of the board. I became board certified. Then they asked me to actually become a board examiner because I was one of the only physicians in the country that was both double board certified in obstetrics and gynecology as well as in cosmetic surgery. So I was a board examiner for a few years. About 3.5 years ago, I was at a scientific meeting in South Florida, and I ran into the CFO for Dr. Miami. And he asked me if I wanted to join the Dr. Miami squad. And at the time I had heard about him. Actually, one of my MAs had been following him for quite a bit of time, and she said, you know, you should really check this guy out. He's doing Snapchat, and social media is sort of the next big marketing tool for everything from physicians, dentists, car dealers, I mean, whatever, you have to get into social media. At the time, I really didn't know what Snapchat or Instagram was, except I knew that my 5 kids were always on it. They were addicted to it. So I met Dr. Miami. I spent a week in his office. I learned a lot of his techniques, specifically his techniques for doing Brazilian butt lifts and tummy tucks and breast augs and breast lifts. So I had like this intense preceptorship with him. Right before I left there, he said, you need a handle. And I mean, well, what do you mean by handle? He says, well, you know, I'm Dr. Miami, and there's another physician in Minnesota that joined me, and he's Dr. BBL. What do your patients call you? Do they call you like Dr. Massachusetts? Or I said, well, actually, I do this really neat thing with bioidentical hormones. They say, we feel so good after getting on bioidentical hormones, you should change your name from Dr. Lowney to Dr. Feelgood. So when I told Dr. Miami, sort of my nickname around the office is Dr. Feelgood, he goes, that's it. You're gonna be the real Dr. Feelgood. And that's how that all started. One of my main focuses with social media, so if you watch me on Snapchat or if you follow me on Instagram, I am all about educating the public. And if you come see me as a physician or if you go see somebody else, what I want to do is teach you something new every day about cosmetic surgery, about age management medicine, about bioidentical hormone optimization, about sexual wellness, because When people are looking to have something done, the first thing they do is Google something. And that's both good and bad, because there's a lot of good information out there on the internet, but there's also a lot of false information on the internet. And try to educate patients. They could figure out what the right procedure is for them, who the right physician is for them, the pros and cons, the risk versus benefits. So by the time they come into my office, most patients, they already know who I am, the quality of my work, and sort of what to anticipate before surgery, during surgery, after surgery. So a lot of their questions are already answered. For me, it's become a great tool to educate patients so they know exactly what they're getting into before they come here.